that you brought to the table, saying that certain countries reporting of suicide is prohibited, then is it also not sweeping the problem under the carpet and also not bringing awareness to this problem?
In fact, in a country, if they go to the extent to give media ethics or media policy to control the media reporting, you can imagine that the measures they are taking to prevent suicide in as far as health is concerned. Therefore, they are not only taking that measure, they are taking other measures too.
Okay.
It's not only the preventing media reporting, that is one of the things that is in prevention of suicide.
Okay.
They are taking all the other measures to prevent suicide. That is one. It is treating mentally ill people, making the agents unavailable, and other measures, and improving the mental health literacy and mental health services. So in this country, especially in Asia, mental health literacy is very, very poor. Mental health literacy means the knowledge about the illness, the effect of the illness, and where the services are available.
Yes.
In this country, that is extremely poor. In fact, they attribute a lot of spiritual thing in mental illnesses, and their remedies are different. Okay, and they don't know how to utilize these services.
That's true.
Those are the issues that should be addressed, and that may be one of the tasks of the media. If they have the social responsibility, there is one media policy that you have a social responsibility in your mass media. Therefore, if you have that, take into the consideration the research finding and adapt your media policy in order to reduce suicides in the given community.
So, in terms of what you said about the mental health education,
yes,
we have a small video ready about how you can really identify. It's an interesting video about how you can identify someone who is suicidal. So I'd like both of you to just take a look at that. We'll take a look at that and come back and just discuss it. We want you to criticize this and tell us if this is right, this is wrong, what is acceptable, what isn't. So let's take a look at that video and come back.
If your friend mentions suicide or self-harm, take them seriously. Have you ever heard of someone who just wanted to end it all, permanently? It's never easy to think about it here. Yes, life can get so complicated and overwhelming, it's hard to even imagine that things would ever get better again. But most people bounce back. Unfortunately, some don't. Suicides are a tragedy. It affects everyone, and it's one of the leading causes of death for people 24 or younger. Here's what to do if you suspect a friend might be having thoughts of suicide. Tip 1. Learn to recognize dangerous signs. Has your friend talked about feeling hopeless or anxious? Have you noticed a change in your friend's behavior? Acting withdrawing, sleeping a lot more, maybe they're abusing alcohol or drugs, giving away their belongings. Maybe your friend has even talked about hurting themselves, or worse, wanting to die. Tip 2. Initiate dialogue in a non-judgmental way. Sit your friend down in a comfortable or familiar environment where the two of you can talk privately and freely. Start by telling your friend how much you care about them, but some other behaviors have concerned you. Household items like pews, razor blades, they quickly become lethal weapons in the hands of a suicidal person. Tip 3. React with feeling. If your friend does confide in you of their thoughts of suicide, be compassionate. Make it known that you are there to listen. Don't aim to change their mind, start an argument, or give advice. Many people who attempt suicide don't actually want to die. They just want their suffering to end, and suicide seems like the only way out. Engage in conversation with your friend and find out what's hurting them. Tip 4. Shift the focus from the sources of pain to resources for treatment. In addition to external challenges, your friend might also be fighting internal demons that requires professional care. Depression, anxiety, and other mood disorders are often present in the suicidal. Many of these illnesses can be diagnosed and treated. Encourage your friend to seek help and offer to work with them to locate a mental professional or clinic. We strongly recommend bringing their family members into this process. Tip 5. Please stay connected. Even after your friend has sought help or seems to be in the process of healing, encourage other friends, roommates, and family members to check in on your friend during this horrible time. This is an especially important step since many suicides occur in a period of apparent improvement. Listen, this video is the starting point. Please do your own independent research and identify more resources. You can save a life just by reaching out to someone who is in need.
That gave a sort of insight also, I think, on what people can do if they know someone who is going through this. If we could just discuss the symptoms first of someone who seems like they're going to attempt suicide or is very seriously going to hurt themselves. Doctor?
Yeah, if somebody says that I want to kill myself, that should be taken very seriously. But there is a general opinion among the people, that if somebody says that I want to kill myself, people think that no, he will never do it.
Yes.
But that is not correct. In the research finding is that the people who have killed themselves have expressed intention of killing themselves more than 80% of the occasions.
I see.
Therefore, if somebody says that I want to kill myself, that should be taken seriously, and that patient is considered high risk patient. And usually we do not deal with that patient with conversation and counseling. That patient need immediate biological treatment.
Okay.
Therefore that patient has to be taken to a psychiatrist. The treatment is immediately indicated. Now, for example, there is there's a therapy, psychotherapy that we give for depression. It's not given for those people who are having high risk of suicide. That perhaps increase the suicide rates. And there is very clear indication that there is organization called Samaritans. The people who want to kill themselves, they can call the telephone, then they can discuss their problems. But that has not reduced the suicide rate. Suicide rate remains the same despite the fact that they can discuss their issues with professionals. That is, therefore, what is really necessary is not discussing, not counseling. If somebody tells that I want to kill myself, I have a plan to kill myself, immediately should be taken to mental health professionals and immediate treatment has to be administered. That is the main message that I have to give.
Okay, I have one last question before we go into another commercial break. Now, with young people, you realize that they always say things very dramatically that, oh, you know, this is terrible, I had a bad day, I want to kill myself. You know, they say that. How do you know when they really mean it? How do you know when they don't really mean it? Because young people today, they just tend to say it very lightly because it's desensitized.
Yeah. Now, if I were to sort of reflect on some of the things that Dr. Gambhir suggested, the fact that the main problem here is we don't know whether the person is contemplating suicide or whether the person is actually wanting to harm themselves as a way of communicating some of their emotions. These are two different things. But in society we have this mixed up. We don't talk much about this deliberate self-harm concept, which Dr. Gambhir clearly classified as two things. So suicide is not the biggest issue in Sri Lanka right now. It's self-harm. It's the rate of self-harm that is increasing. Actually, the suicides have come down with the banning of the lethal pesticides some time ago from the same presidential task force that Dr. Gambhir mentioned. So here the problem is that we have the messages mixed up. We don't know whether a person is suicidal or not. whether that person is just contemplating self-harm when they're saying that I'm going to kill myself.
Yes.
So we take it very lightly.
We do.
That's an issue. And I suppose what we should look at is whether look at the background of that person, look at whether the everyday lifestyle of that person has changed, whether he's spending more time isolated, or whether he's actually doing things as he used to do. Does he have hopes for the future, or is he kind of not thinking about anything, and he's really in this isolated, depressed way? He's not taking good care of himself, he's not dressing properly, he's not eating properly. If his everyday life has changed and he's saying these kind of things, then you should be very considerate about it.
I see.
But if it's something other than that, if it's just a spontaneous thing, then it's still okay to ask them whether they really mean it, and ask them whether they are going through some tough times in their lives. It would help to ask.
Okay. On that note, we have to take a short commercial break, but all of you, just to remind you, you can write to us on mtvsports@maharaj.lk or join us on our Facebook page for Good Morning Sri Lanka, and leave your comments and your suggestions, any other questions that you would like us to ask our experts. So we will see you on the other side after this short commercial break. Welcome back to GMSL, and just before the break we were discussing the issue of suicide, and we were really getting down to a lot of the nitty-gritties of this very serious social problem. And what we were discussing was the telltale signs in someone who is basically entertaining these thoughts. Now we discussed the telltale signs of somebody who is vocal about it and who says, okay, you know, who says I'm going to kill myself. But what about certain people? Does everybody actually vocalize it, or does it happen like you said, ma'am, you said, you know, in sociology you look at the phenomenon as an instantaneous thing. Then how do you look out for telltale signs at all?
Yeah, there's no telltale signs in that sense, but here I'm strictly referring to deliberate self-harm.
Yes.
And these people do, I mean, most of them would have some of them would have tried to attempt suicide like 10-20 times even, and because our treatment is so good and we have a free health system, they survive it. And if you ask them, did you really intend to die, they would say no.
But they keep doing it.
They keep doing it because it's an option in their lives. When they have problems, that's the way that they express it, or that's the way that they communicate.
Is it also a way of escaping a problem?
More than escaping, it's a message. It's a message to another party. That's what it has always been.
Okay.
To your wife, or to your husband, or to your children, it's a message. You want them to do something for you, then they are not listening to you. So you do this, and then they listen to you, and it always works. So it gets reinforced.
I see.
And they do it over and over again, and it's a learned behavior. So in that sense, you don't have telltale signs. In sociology, we don't have that privilege of getting to say that that person is going to be suicidal in this amount of time. We don't. But when you go in depth and try to understand why they did it after they have done it, you see that these are not really sort of like mental problems or anything. It's many things.
Okay.
Actually.
Doctor, your thoughts on that?
Yeah, in fact,